receptors of 5-HT, they are 5-HT1 to 7। तो इसका रिसेप्टर जो होता है 5-HT1, उसका भी सब टाइप्स है 5-HT2, 5-HT3, ऐसे करके 5-HT7 तक है। ठीक है। So all these receptors are G protein coupled receptors. So all these receptors are G protein coupled receptor except one. And what is that one? That is 5-HT3. Okay. तो बाकी सब रिसेप्टर्स G protein coupled receptors हैं except 5-HT3, जो कि 5-HT3 है ion channel receptor. Okay. तो एग्जाम पॉइंट ऑफ व्यू से हमको बस 4 ही रिसेप्टर को याद करना है 5-HT1, 5-HT2, 5-HT3 एंड 5-HT4। ओके। तो अभी हम लोग जाएंगे इंडिविजुअल रिसेप्टर में और इंडिविजुअल रिसेप्टर के अंदर कौन कौन सा ड्रग है। तो पहले हम जाएंगे 5-HT1 रिसेप्टर्स। सो 5-HT1 के भी सब टाइप्स हैं जैसे मैंने बोला था। सो 5-HT1A इसका पार्शियल एगोनिस्ट है। 5-HT1A partial agonist. And what are these drugs? The name of this drug are buspirone, then gepirone, then ipsapiron. Okay. इनका मैकेनिज्म ऑफ एक्शन क्या है? 5-HT1 रिसेप्टर जो है ये कहाँ पे प्रेजेंट है? These are present प्री-सिनेप्टिकली। तो क्योंकि ये प्री-सिनेप्टिकली प्रेजेंट है तो अगर हम इसमें पार्शियल एगोनिस्ट देते हैं तो क्या होगा? This will act as brakes, and if will act as brake, there will be inhibition of release of 5-HT. So there will be decreased 5-HT. तो decreased 5-HT होने से क्या होगा? Reduction of anxiety होगा। So these drugs, these are given for anxiety, and they are used for chronic anxiety. Okay, generalized anxiety disorder. Okay. अब ये क्वेश्चन एक आ सकता है कि why these drugs are not used for acute anxiety? Because these drugs require 2 to 3 weeks to start working, so not preferred in acute anxiety. Okay. और दूसरा ड्रग जो दिया जाता है एक्यूट एंजाइटी में वो क्या क्या है? बेंजोडाइजेपिन्स। तो बेंजोडाइजेपिन्स के साथ साइड इफेक्ट्स क्या रहता है? टॉलरेंस हो सकता है, डिपेंडेंस हो सकता है, सिडेशन हो सकता है। ओके। All these three things they are not there with 5-HT1A partial agonist. 5-HT1A partial agonist में there is no sedation, no tolerance and no dependence. Okay. तो क्या क्या नाम था जो हमने पढ़ा था 5-HT1A partial agonist में? बिस्पिरॉन, जेपिरॉन, इप्सापिरॉन। इसमें एक नाम है बिस्पिरॉन। इसको बहुत लोग कंफ्यूज कर देते हैं विथ ब्यूप्रोपियोन। This drug bupropion, it is an atypical antidepressant. ठीक है। It is used for smoking cessation. तो डिफरेंस याद करने ना, बिस्पिरॉन, bupropion. Bupropion is an atypical antidepressant, whereas buspirone is a 5-HT1A partial agonist. Okay. Now coming to 5-HT1B and 1D agonists. 5-HT1B, 1D agonists. So what are the drugs which are 5-HT1B and 1D agonists? These are the triptans. So what are these triptans? Sumatriptan, zolmitriptan, probatriptan, rizatriptan, elitriptan, naratriptan. ओके। इसमें से आपको याद रखना है सुमाट्रिप्टन, इट इज अवेलेबल एज ओरल, सबक्यूटेनियस as well as intranasal route. Okay. Zolmitriptan is available as intranasal route. Probatriptan is long acting and rizatriptan is, याद रखना, रिजा just like razor, Okay, fast acting. Okay, so what is the mechanism of action? 5-HT 1B 1D एगोनिज्म करेगा। तो ये एगोनिज्म करने से क्या होगा? वासो कंस्ट्रिक्शन ऑफ द क्रेनियल वेसल्स होगा। सेकेंडली, ये डिक्रीज करेगा न्यूरोजेनिक इन्फ्लामेशन को। ओके, बाय द डिक्रीज्ड एक्टिविटी ऑफ कैल्सिटोनिन जीन रिलेटेड पेप्टाइड सीजीआरपी। सीजीआरपी का फुल फॉर्म क्या है? कैल्सिटोनिन जीन रिलेटेड पेप्टाइड। ओके, तीसरा चीज ये क्या करेगा? डिक्रीज करेगा नोजिया, डिक्रीज करेगा वोमिटिंग। तो ये तीन चीजों की वजह से ये क्या करेगा? आपका माइग्रेन अटैक में यूज होता है। ओके, सो इट इज द ड्रग ऑफ चॉइस फॉर एक्यूट अटैक ऑफ माइग्रेन। माइग्रेन को हम और एक वीडियो में डिस्कस करेंगे, ठीक है, इन डिटेल्स, and that will be discussed from both the books, Harrison and K.D. Tripathi. Now coming to what are the contraindications of triptans. These contraindications are because the triptans are vasoconstrictors. Okay, so that is why it is contraindicated in case of which disease? Ischemic heart diseases. Also, coronary artery spasm. Then it is also contraindicated in case of pregnancy. Apart from this, there are certain drug interaction of triptans. तो अगर ergots दे रहे हो, उसके साथ अगर triptans आप मिला दिए, तो ergot भी क्या करेगा? vasoconstriction करेगा, triptan भी vasoconstriction करेगा. So these are never given together. Never given together. Okay. So you have to give at least 24 hours of gap between ergots and triptans. Okay. ट्रिप्टेंस को दूसरा चीज है ड्रग इंटरेक्शन. ट्रिप्टेंस दे शुड नॉट बी कंबाइंड with SSRIs or SNRIs. What are these SSRIs and SNRIs? Selective serotonin reuptake inhibitors and serotonin and noradrenaline reuptake inhibitors. तो इसमें क्या होगा? SSRI SNRI क्या करते हैं? They increase the 5-HT and these triptans, they are also partial agonists, 5-HT1B 1D agonists. So there is a risk of serotonin syndrome. Okay, so because there is a risk of serotonin syndrome, the triptans should not be combined with SSRIs or SNRIs. Next, coming to 5-HT1F agonists. 5-HT1F agonists. Okay, so the drug is lasmiditan. So this has no vasoconstricting effect, but it decreases the calcitonin gene related peptide. So what is the pathophysiology of migraine? There are two theories. One is vascular theory and another is neurogenic theory. In the vascular theory, it states that there is vasodilatation of the cranial blood vessels and hence there is headache. The second theory, that is neurogenic theory, it states that there is neurogenic inflammation, thereby there is increase in the peptides like calcitonin gene related peptide and that causes migraine. So this lasmiditan, it decreases the calcitonin gene related peptide and it is helpful in migraine. So it is used in the treatment of acute attack of migraine in patients with cardiovascular risk. Okay, so these were all the drugs which were acting on the 5-HT1 receptors. Now coming to 5-HT2 receptor. Okay. So 5-HT2 receptor, the 5-HT2 antagonist, these are the atypical antipsychotics. What are they? Clozapine, olanzapine, risperidone. Okay. So these are discussed in the antipsychotic drugs. Another drug is there, 5-HT2C agonist. This is already banned drug, and the drug name is lorcaserin. Okay, it was used for obesity, but it has been banned now because of the increase in the carcinoma risk by this drug. Now another drug is there, 5-HT2 antagonist and 5-HT1 agonist. The drug is flibanserin. And the use of this drug you can remember by its name itself, F-libserin. Okay, it it is used in female libido, decreased female libido. It is used. That is, it is used in female hypoactive sexual disorder. Okay. Next, coming to 5-HT3 antagonist. This 5-HT3 antagonist we will be discussing when we will be discussing the drugs acting on the GI tract. So the examples are ondansetron, granisetron, palanosetron, dolasetron, and these are used in chemotherapy-induced nausea vomiting, radiotherapy-induced nausea vomiting, then post-operative nausea and vomiting. 5-HT4 agonist is there, and the name is prucalopride. Earlier there were another two drugs, that is cisapride, mozapride. Okay, these have been banned by FDA because of their increase in QT prolongation. Okay, but prucalopride, as because it has low pride, this has not been banned. इन लोगों का प्राइड ज्यादा था, इसलिए इन लोगों को बैन कर दिया गया, सीजा प्राइड, मोजा प्राइड. बट ट्रू कैलोप्राइड मैं इसको ऐसे याद रखता हूँ बिकॉज इट हैज लो प्राइड, देयरफॉर दिस हैज नॉट बीन बैंड बाय द FDA. Okay, so prucalopride, it is used in GERD, that is gastroesophageal reflux disease. Okay, so in gastroesophageal reflux disease, prucalopride is used, and it is a 5-HT4 agonist. So let us make a table for a quick revision of 5-HT receptors. Okay, so we'll make a table. We'll write serotonin receptors. Okay, the location of the receptors. Then we'll write the action of the receptors, the nature of the drugs, examples of the drugs, and finally the uses of the drugs. So there are 5-HT1A receptor, the important ones, 5-HT1B, 1D receptors, 5-HT2A, 2C receptors. Okay, then 5-HT3 receptors, then 5-HT4 receptor. Yes, so 5-HT1A receptor, it is present presynaptically. It acts as brake and reduces 5-HT. Okay, the drug is agonist, and the example is buspirone, gepirone. Okay, and what is its use? Used in anxiety. 5-HT 1B1D receptor. It is present in the blood vessels of brain. What is the action? Vasoconstriction. It is agonist. Okay, and what are the drugs? Sumatriptan, naratriptan, zolmitriptan, etc. Okay, and these are the drug of choice in acute severe migraine. Yes, 5-HT2A, 2C. These are present in the brain. Antagonists. These are atypical antipsychotics used in psychosis and mania. Okay, and these are clozapine, olanzapine, risperidone. The details of these drugs will be taught to you in antipsychotic lecture. 5-HT3, where it is present? It is present in the chemoreceptor trigger zone, CTZ. What is the action? Emesis. Okay, so antagonist will be given, and these antagonists will counteract the emesis. What are these drugs? These are ondansetron, granisetron, palanosetron, okay, dolasetron, used in CINV, that is chemotherapy-induced nausea and vomiting, radiotherapy-induced nausea and vomiting, and post-operative nausea and vomiting. Then 5-HT4, these are present in the GIT. Okay, prokinetic action is there. Agonists can be given for this. Example, cisapride, mozapride, prucalopride, used in GERD, that is gastroesophageal reflux disease. 5-HT5 receptor is present in the CNS. No need to remember the action of the receptor. Okay, so mainly we need to remember 5-HT1, 2, 3, and 4. Okay, so that's all about serotonin, that is 5-HT, and the various receptors and drug acting on the 5-HT receptors. Thank you.